Welcome to the Ask Dr. Tommy O Show. The Ask Dr. Tommy O Show takes a comprehensive approach to our community's healthcare needs. I'd like to thank Bishop Burkett for this opportunity to have the Ask Dr. Tommy O Show. The Ask Dr. Tommy O Show has been on the air for 4 years. Over the past 4 years, we've won a Beta Award as well as nominated twice for the Best Health Care Show. Today, we have a very important show that's overlooked by the total population. This is something that's very important, and it's a new service that is provided by La Casa de Salud. The new service I'm talking about is a program called Dental Health. Today's topic, we will discuss oral hygiene. I'd like to introduce today's guest to our audience, Dr. Azadeh Feeney. Dr. Feeney, welcome to the Ask Dr. Tommy O Show.
Thank you for inviting me today.
Dr. Feeney, we're offering a new service, and you're the provider for this service.
Yes.
The service is called Dental Health. Talk about dental health and what it means to you. But before we get into that, I'd like to talk about what drew you to the profession and to decide to have a career in dental health.
Okay, well, it all really started out in high school. I, took a variety of courses. I really excelled at sciences. I really enjoyed it, getting to know about the body, how it functions, and continued with that through my undergrad degree. I ended up taking a lot of biology courses, science, like other science ones like psychology, mathematics, and, I got into my second year, and a lot of my friends in the same stream were trying to decide, what career path they were going to go down. A lot of our advisors had told us to go and job shadow. Right. And so a lot of my parents' friends were medical doctors, dentists, so on. And I was really interested in the health field. I really wanted to help people. And I thought I would really enjoy this as my career, something I can, be proud of at the end of my life. So I ended up going and job shadowing, taking a look, seeing what it's really about, because from the outside, it's one thing, from the inside, it's very different. Right. And, I've obviously been to the dentist many times in my life for checkups and stuff, like everyone should, right. And as well as the medical doctor my whole life. And it was different being like job shadowing, wearing the white coat, like following the doctor or the dentist around and seeing how they interact with different patients. Right. I've always had a very, very good interactions with both the medical doctors and the dentist. But when I was there, watching them perform the procedures and stuff, I realized that was kind of my calling. I really enjoyed it. I like helping people. I think that there are a lot of struggles where the dental field is concerned in terms of people with phobias and so on, and I really thought that I could contribute and make a difference. So I kind of went along with that. I did a 4-year undergraduate degree. And along with that undergraduate degree, I also wrote a standardized test called the DAT, which is a dental aptitude test. My grades combined with the DAT scores allowed me to get into dental school. Previous to New York, I resided in Toronto, so I went to school at the University of Toronto for 4 years. I graduated in 2006. And, I've been coming down to New York for many years. Love the city. I think the people are great. There's always something to do. And so I thought it'd be a great place to sort of start out my career. I decided I would apply for a residency program just to sort of get acquainted with the way, and the systems are different, the Canadian system as opposed to the U.S. So I came here, did my residency at Lutheran Medical Center in Brooklyn. Mm-hmm. I learned a lot. Saw a lot of patients, got very comfortable really, being a practitioner, and have continued on here. And so now I'm at the primary dentist at La Casa de Salud, yes. Working with you, of course, for the past 6-7 months. It's been really great, and that's how I got here.
Right. Yeah. Well, we've been working together, as you said, for at least 6-7 months, almost a year. We're approaching a year now. And our approach to healthcare is almost exactly like dental health as well as primary. We take a holistic approach to the patient's care. With me, it's the primary or family care. With you, it's dental health. And what's really important is because we have a close relationship as professionals, but even personally, we're able to communicate at a different level, and we're able to enjoy this relationship because we discuss the patients, the care between the two professions, because it's very important, because I deal with diabetic and hypertensive patients. And there's a big concern when I'm treating diabetic patients or patients that have hypertension, and when they want to go across to see Dr. Feeney and have a dental procedure. So I have to make sure their blood pressure is stable as well as their blood sugar. So, and then there'll be other procedures where there's a dental procedure, and then you'll come across to me and ask, for my professional advice, or vice versa, where I ask your professional advice, and we take a comprehensive approach to the patient care here. Very important. That's number one here in La Casa de Salud. Well, today's topic, as we discussed earlier, it's oral hygiene. So could you define what is oral hygiene? Because we hear this term, but what does oral hygiene mean?
Well, it's really maintenance. And, like a lot of people have regularly go and see their doctor, once a year, twice a year for their checkups. And it's the same thing, but it's for your mouth, it's for your teeth, just to make sure that everything's in line and, nothing is going astray. Mm-hmm. So a lot of people, they usually don't really come to the dentist when they have tooth pain or, something is going wrong. Right. They don't really look at the prevention aspect of it as much as they do, medically. So that's really what oral health is all about, just making sure that everything is in tip-top shape, getting regular cleanings done, which prevents a whole slew of other dental problems, and in the long run, it saves people a lot of money because they prevent more costly procedures, right, that would have to be done if they left the teeth to decay, basically.
Right. Unfortunately, in our community, you see that the first thing, unfortunately, when economics start to get tight, the first a healthcare provider they cut out is typically the dentist. You were talking about prevention. We call it healthcare maintenance, but it's exactly the same. We take a proactive approach. Right. Prevention. We want to prevent dental pathology. I want to prevent further pathology, like with your diabetes, if it advances, or your hypertension. I want to make sure your sugar's controlled as well as your blood pressure. Here, Dr. Feeney, you work on preventing dental pathology.
Right.
Now, is this pathology only limited to the teeth?
Absolutely not, of course. And you know what? Most people actually have problems with their gums. And so, when they notice if they're brushing and their gums start to bleed, a lot of them don't even freak out. They think it's actually normal. It's what's supposed to happen. It's not. Majority of people suffer from gingivitis, mm-hmm. which is inflammation of the gums, and that's really mainly due to plaque buildup in between the teeth as well as like inside the pockets. And the best way to fight that is toothpaste, regular brushing, regular flossing. And I know that's very difficult for a lot of people to spend, the recommended 2 minutes really getting to every nook and cranny and brushing their teeth. Majority of people brush for 20 or 30 seconds and they think they've done an adequate job, mm-hmm. when in fact they should be brushing for a full 2 minutes. That's why a lot of times I recommend people buying electric toothbrushes, even though it's a bit more costly. A lot of them have timers. They properly brush the teeth, but all you have to do is literally hold it into position and move it around, mm-hmm. And it beeps 30 seconds in each part of the mouth, which is really great. It does cost a bit more money, but long run, I think it really prevents a lot of diseases, gum disease, tooth disease, all that stuff. So long run, it actually saves you a lot of money.
Right. Saves a lot of headache and pain.
Absolutely. And, taking time off work, people don't
right.
put these into the equation,
Sure.
to come and see the dentist if there's a lot of pain. The other thing, they can always obviously buy a toothbrush. I recommend using a soft bristled toothbrush that's ADA recommended. Mm-hmm. And of course, flossing. Twice a day. Every time that you brush, you should floss. Majority of people think it's like a new concept. It's not. And, getting the plaque, which is like housing of bacteria, away from between the teeth, also gives you better breath. A lot of people complain about having bad breath, and they're saying, the mouthwash or gum or whatever is not helping. Well, it's not curing the cause, right. And that, again, has a lot to do with the bacteria or food caught between the teeth, things like that. A lot of people that are on medication, it causes dry mouth. That causes halitosis, that bad breath that we're talking about. And again, the best combat is to regularly brush your teeth, to floss your teeth, to come to the dentist to get a regular cleaning every 6 months, because there's a lot of that plaque that people, they sit there and they scrape their teeth like, so hard, wearing the tooth enamel away, but they're actually not getting rid of the plaque or the calculus because physically you can't. And that's why it's really important to come to the dentist, get that taken care of, because we have the proper instruments to safely remove it, and that can prevent the bad breath, save your gums. And the thing is, you leave it, it gets worse, and it causes periodontitis, which is inflammation of the bone, which it houses the teeth. And that inflammation causes bone loss. People that notice if they have like receding gums, well, that's actually your bone being, there's a disease of the bone. The bone's being worn away, and that's what's causing the teeth to look longer. Well, that has really bad outcome, long-term prognosis, because you can end up losing your teeth and causes a whole bunch of other problems. So, it's kind of like a domino effect. So prevention, education is really number one.
Right. Well, you made a couple of points that I'd like to just reiterate. One would be healthcare maintenance. Every 6 months, you should come in just for a routine dental cleaning, a dental or tooth exam. Very important. Unfortunately, like myself, I'll admit, sometimes I'll go for a year and a half. But, I'm so involved in giving and being a caretaker for some, my patients, I end up neglecting my own health. And unfortunately, this is a fact of reality for most physicians. We don't take care of ourselves because we're taking care of others. But you were saying that every 6 months you should come in for a routine cleaning.
That's right.
You want to brush your teeth, and I like to go over the proper way of brushing your teeth. You spoke about 2 minutes. You want to make sure you have all 4 quadrants, upper, lower, right and left side.
That's right.
For at least 2 minutes. Well, let's get back to brushing. Now with me, because I use the type of grip I use, and I use a hard bristle, and I learned my lesson because I had to have those grooves filled in. Where I was using a hard bristle, and I was the kind of stroke, and I'll just demonstrate, I was gripping the toothbrush this way, and because I'm trying to get that plaque off, and I have good teeth where, because I wore braces. But, I was told through my, all the years under the care of my dentist that I have very little plaque formation. But in my mind, I would think, and just like with anyone else, the harder you brush, you're going to make sure there's no plaque formation buildup. However, there's a danger because you break down, you wear down the enamel, and which I had, and I had exposed my teeth, their inner core was being exposed. And you're talking about being painful because now you're being exposed to the nerve, and I had to have that repaired. What are you going to do? So what would you advise the proper way to brush your teeth? We already said soft bristle, but is there a type of direction or how you hold the brush?
100%. So as you're right, Dr. O, a lot of people, they take the toothbrush, and I always use this analogy as if they're scrubbing a toilet.
Right.
And you should think of it less in terms of scrubbing and more like polishing. You want to polish stuff. The scraping and all that should be left to the dentist to do, really, truly, because you won't be able to get it off. If it's built up, if it's a plaque and it's built up like that. So, and you want to hold it, with as if you're holding a pencil, and with that much pressure. And I really mean I hold it with my with my thumb and my forefinger. That's it.
So it's not a baseball grip.
Full grip. That's right, because it's too much pressure,
Right.
And so you're gonna hold it almost like a pencil. Okay, so the way you would hold a pencil, you're going to pick it up the same way. And it's funny, and the first time you try to brush it, you feel like it's going to fall off. But the whole point is that balance. That's how much pressure you should be putting on the teeth. So if you feel like it's the toothbrush is flipping out, you're putting too much pressure. Lighten up, and you'll get used to it very quickly. The other thing you want to do is brush in a circular motion. The bristles should be angled just a little bit underneath the gums. Okay, to get underneath the gums to get the plaque and the calculus out so it doesn't build up. And you want to do it very softly in a circular motion. So you're going to hold it circular, circular, circular. When you're going to do the lower teeth, same thing, angle the bristles into the gum a little bit to get underneath and get all that plaque and calculus out. You go around, you do that. Really recommended 2 minutes. Some people time it, they really do, and I think it's very effective. You'll get used to that, And again, I really recommend electric toothbrushes for the fact that they do have timers on them. People spend the adequate time. If you get the electric toothbrush, that saves you all the work of the technique, because you just have to literally hold it in place, and it does the work for you. The other thing I really want to also address is toothbrush that have the whitening effect. There's a lot of toothpaste out there that are advertising this.
Right.
I don't really think they're very effective. They may get the external stains off temporarily, but they don't really get to the heart of the matter, basically. And what it really does, more or less, it damages your teeth more than helping them, because you end up wearing your teeth away because it's very abrasive. So I recommend using fluoridated toothpaste, and then if you really want to do whitening, leaving that to like bleaching techniques. That's the alternative. And sorry, and actually that brings me, if you don't mind me talking about stains. A lot of patients bleaching is number one concern most patients. And thing is, I think it's effective. I've done it. Definitely does change the tooth shade color, whether you do professional or at home, depending on your economic background or status. But stay away from things like cigarettes and smoking. It's like smoking cigarettes or drinking red wine or coffee, things like that. If you want to, that's right, all that stuff, rots the teeth, it stains them, things like that. And other things to prevent, now that I'm thinking of like cavities, for example, is staying away from those sticky, chewy candies that people chew, and it causes a bad acid effect inside the mouth, increases the chance of getting cavities so much more. People, if you have a sweet tooth and you want a bit of chocolate, I think dark chocolate's a good alternative. Health-wise, people are, it's all the buzz. It's good for you, for your health. It's antioxidants and so on. It's also good for the mouth, the antioxidants, as well as has less sugar than milk chocolate or white chocolate. The other thing that you want to do is chew gum. Has especially the sugar-free types with xylitol in it.
Yeah. What about the Dentine? We hate a commercial of Dentine. What do you think about that?
Well, I don't want to be sponsoring any companies, but actually Trident has xylitol in it, which I mentioned, which they spent a lot of money and effort to try and get that ADA approved, and it's antibacterial, so it's very good. Actually fights against cavities. So chewing that is a big bonus. Other things you can do, there's so much. I don't know. I can't think of anything else. Anything else that you're curious about?
Yeah. Well, I like to go over two points here. We're talking about with the staining.
Yes.
I like to bring up a very important point that depending on how old you are, if you're in your fifth decade, in your 40s or 50s, especially when you were a child, like with myself, we only had few antibiotics at the particular time, and for me particularly, I am anaphylactic to penicillin, so I was prescribed tetracycline, and tetracycline, that will stain your teeth. So no matter how hard I scrub, I have my teeth stained, and that was from the tetracycline. And that's why we try not to prescribe tetracycline to children under the age of, we say, an adult age, which would be considered 16. So that would be, if you use a lot of tetracycline when you were younger, especially if you're in your fourth or fifth decade, we prescribed that. I wasn't a physician at that time. I was a teenager, actually younger than that. But unfortunately, if you were given tetracycline under the age of 16 years old, that probably will cause or caused some of your teeth to be stained. You also, I have an opinion about eating at night, before you go to bed. Now, I'd like to address that medically. But what's your feeling about eating late at night and then going to sleep without brushing your teeth?
Oh, that's by far the worst. You have the least amount of saliva production at nighttime, and that is really actually is one of the things that combat cavities the most, is the saliva. It buffers against the acids, tries to neutralize them. So if you eat, there's already probably food stuck between the teeth, because obviously if you didn't brush, you didn't floss. There's food stuck on the surfaces of the teeth. That causes rampant decay. It really does. And the thing is, because you go to bed right after, the saliva production decreases dramatically. And so it's a haven for bacteria acids, and those go ahead and cause cavities. So really, definitely recommend against it. If someone's hungry and I know that you guys recommend say not to eat. I think it's 2 to 3 hours before bedtime. Right. But even if they are to eat, really recommend brushing your teeth really quickly after. Even if you've brushed after dinner, just do a quick, thorough go through. Make sure that there isn't anything left. It's all about prevention, really.
Right. Well, part of dental pathology for children, I like to tell my pediatric patients, actually the parents, but as well as the pediatric patients, not to eat their last meal late at night, and there's a reason for this. This is a lesson that I've learned, and I learned this when I was in medical school. That I used to wake up like 2 or 3 o'clock in the morning and then drink a lot of milk and then go back to bed. Well, milk has sugar lactose. And I would go to sleep with lactose on my teeth, and I'd go to the dentist, and the dentist, I would have cavities, and I was yuck mouth. And you remember the commercial when we were growing up? You go back about 15, 20 years ago, there was a commercial for yuck mouth. Well, that was me. I was yuck mouth, and my parents would tell the dentist, make sure you tell Tommy to brush his teeth. And I would say, I do brush my teeth. But I did not tell my dentist or my parents that I was getting up like 2 or 3 o'clock in the morning and drinking a nice glass of milk and then going back to bed. So if you want to prevent or at least reduce the risk for dental caries, which is cavities, don't eat late at night and not brush your teeth. So if you're going to eat, then you have to brush your teeth after the meal. But from a medical perspective, for children, they have a high propensity of developing ear infections, especially infants. A lot of parents will send their children to bed with the bottle in their mouth. Now you're talking about gum disease, as well as developing middle ear infection. So this is something that we want to reduce the risk. So don't send your children, and you shouldn't go to bed with food, especially carbohydrates. We're talking sugar, milk, cake, cookies, whatever you're eating, without brushing your teeth. So make sure before you go to bed, have a clean mouth.
The other thing, sorry if you don't mind me addressing, you brought up a very good point about children and going to bed with bottles. And that's been done, I think, for as far as anybody can remember. Right. But really it is bad. Children, they drink the milk. A lot of them, they shouldn't actually go to bed with milk or juice for that matter. They can drink it if, you're kind of putting them to bed, but it should always be followed up by water in the bottle. And obviously, mothers are wondering, water in the bottle, but really it's important to flush out any milk or residue that's left in the mouth. Right. And also even just taking a damp cloth, like a little towel, putting it around your finger and just going around and making sure that there's nothing really left in the mouth, because usually they pull it right below their as they're suckling on the bottle, they're pushing it up against the top teeth, and they're rotting away at a really bad rate.
Right.
So really preventing that, they shouldn't really go to bed with bottles, to be honest. And I know that that's like an old way of thinking, and mothers
It's
pass that
down
down to their daughters, right?
generations.
And no one knows better, but really it's really important that you get the children into the habit of drinking their milk while they're awake. And then if they need something to go to bed, then you can always give them water in a bottle, if they're used to that. But really I think that's probably like one of the best methods.
Okay, wonderful. Well, there was one other topic you wanted to discuss, and we're talking about benchmarks through growth, because if you notice the changes in the meat with all the steroids and antibiotics, that you're noticing a difference and advancement.
That's right.
With growth and maturity. Would you be able to explain what you're seeing on your dental exams?
So just as I guess you've seen children developing, height-wise and
maturing,
weight-wise, right, at much quicker rates, I've seen the same thing dentally. So usually, people get their first molars at 6 years old, 6.5, and then, at around 13 or 14 years old, get your second molars in. I've seen children that are 8 or 9 that already have their second molars in. So yeah, I think it's the environmental factors, the hormones that are in foods, that all the processing, all that stuff is causing this advancement. So whereas before, people would say, patients should get braces at around 14 or 15 once all the molars and all the permanent teeth are in. Kids are advancing at such fast rates nowadays that, if they need orthodontics or things like that, they need to come regularly, make sure that someone is following their progress and their development.
Okay. Well, stay alive with Church Alive. And we're going to close out the show with Dr. Feeney. She'll be working on a patient where you'll see her in action. Thank you. God bless.
Larry, I'm gonna lay you back, okay? Yeah. Okay, here we go. Good. Now we're gonna bring you up a little bit. Good. I'm gonna lay you back a little bit more. Fantastic. Okay, Larry, you're gonna open for me. Good. I think it's this tooth that is hurting you because it has a really big cavity in it. Does that hurt? Does that hurt? Okay, and the last one? Yeah, okay. Okay. And tap down here. Is that okay? Is that okay? Is that okay? I'm just going to check around, check the bone. Okay, I'm sorry. I know. I'm sorry. Okay, so I think it's that tooth is the culprit. Has it been waking you up at night?
Yeah, so
It
I
has.
can't go to sleep.
Okay. It's your wisdom tooth that has a really big cavity in it. Okay, and it's very broken down to the point that it is not going to serve you any purpose for the future. So the best thing to probably to do is to extract it.
Today?
If you want to be out of pain, yes, I think so.
Yeah.
Yeah. Okay.
So I'm actually getting to it. So that's the reason why something my whole jaw is something kind of that
Absolutely.
too.
Absolutely. Yeah, it kind of spreads.
My head and everything. Yeah. Yeah.
Absolutely. Okay. Perfect. So I'm just going to set up, okay, and then we can get started. All right.
I wish they told me.